The hospital cafeteria hummed with a low murmur of exhausted conversations and the clink of silverware on plates. Fluorescent lights casting their harsh glow over healthcare workers stealing precious minutes of rest, and the smell of industrial coffee mixed with disinfectant as Elena Rodriguez collapsed into a corner booth, still wearing scrubs that bore the stains of a brutal 12-hour shift that had turned into 14. If you believe healthcare workers deserve basic respect, like, share, and subscribe. Elena had been an ICU nurse for 7 years, working night shifts at Metropolitan General Hospital while raising her 2 daughters alone after her husband died from the same cancer that had made her want to become a nurse in the first place. Every shift was a battle against understaffing, underfunding, and the kind of emotional exhaustion that comes from holding people as hands as they take their last breaths, while knowing you need to immediately move to the next patient who is codeine in room 12. She'd managed to grab a sandwich from the vending machine. Her first food in 9 hours and was sitting there with her eyes closed for just a moment, trying to find the energy to eat before her break ended in 15 minutes. Then she heard the voice, loud and entitled, coming from a table of businessmen in expensive suits. Look at her, probably been sleeping on the job. That's why healthcare is so expensive. Half these nurses don't do anything but complain about being tired. His colleagues laughed, one adding, "My wife's a yoga instructor. Works way harder than nurses. They just take temperatures and give out pills. Could train a monkey to do that job?" Elena's eyes opened slowly, her jaw tightening, her hands beginning to shake, not from fear but from the rage of being reduced to nothing by people who had no idea what she'd just spent the last 14 hours doing. The other nurses and doctors in the cafeteria had heard it too, heads turning toward the businessman's table, expressions hardening. But nobody moved yet, everyone too tired, too beaten down by the system to have energy for confrontation. Elena took a breath, squared her shoulders, and made a choice. She stood up, her legs unsteady from exhaustion, and walked directly to their table, her voice quiet but carrying the weight of 7 years of life and death decisions. "Excuse me, I'm the nurse you were just talking about, and I'd like you to know what I've been doing for the past 14 hours while you've been sitting in meetings." The men looked startled. One actually had the decency to look ashamed. But the ringleader designer suit Rolex, the kind of confidence that comes from never being held accountable, leaned back in his chair with a smirk. "Oh, did we hurt your feelings? Maybe you should develop thicker skin if you can't handle a little criticism. That's the problem with your generation, too sensitive." Before Elena could respond, something remarkable happened. Sound like chairs scraping across linoleum, synchronized and purposeful, and she turned to see every healthcare worker in that cafeteria standing up. Doctors still in surgical caps, nurses from every department, respiratory therapists, a paramedic who'd just brought in a patient, even the tired resident who'd been sleeping with his head on the table, all of them moving to stand behind Elena, forming a wall of scrubs and determination. Dr. James Chun, the ICU attending who'd worked alongside Elena through countless crises, stepped forward first, his voice carrying the authority of someone who'd spent 30 years in medicine. "That nurse you just insulted has saved more lives before breakfast than you'll impact in your entire career. She works in conditions you couldn't handle for 5 minutes. And she does it for a fraction of what you probably make while producing nothing of actual value to society." A surgical nurse named Patricia, still wearing her booties added with steel in her voice. "Elena held my hand and talked me through my own father's death last year. Sat with me after her shift ended because she knew I needed someone. The RK doctor, a woman with gray streaks in her hair and eyes that had seen everything, pulled out her phone and started recording. "I want your names and your company, because I'm going to make sure your employers know exactly how their executives behave." The ringleader's smirk was gone now, replaced by the red-faced realization that he'd miscalculated badly, that healthcare workers might be exhausted, but they were also a tribe, a family forged in the fires of trauma and loss. A janitor named Marcus, who'd been cleaning tables, stopped his work and spoke up, his voice thick with emotion. "My son is alive because Nurse Elena recognized his sepsis symptoms when 3 doctors missed it. She fought for him to get treatment. She saved his life." The cafeteria manager walked over with her arms crossed. "Gentlemen, I'm going to need you to leave. We serve healthcare workers here, people who actually save lives, and you're not welcome to stay after disrespecting them." One of the businessman's colleagues finally found his spine, standing up and saying, "You know what, Steve? That was way out of line. These people are heroes, and we were acting like entitled jerks. I'm out." And he walked away from the table. The hospital CEO, who'd been having a quiet lunch in the corner, approached the table with her badge clearly visible. Her voice professional but ice cold. "I'm Dr. Rachel Morrison, CEO of this hospital, and behavior like yours toward my staff is unacceptable. If you're here visiting a patient, I suggest you conclude your visit and leave. If you're here for business, that business is now concluded, and you're hereby banned from non-emergency access to this facility." The ringleader tried to bluster. "You can't ban us. I'll call my lawyer." But Dr. Morrison was unmoved. "Actually, as a private hospital, we absolutely can refuse service except in emergencies. Now leave before I call security." As the men gathered their things and headed for the exit, walking past the wall of healthcare workers who'd stood up for Elena, the entire cafeteria erupted in applause, not for the men leaving, but for Elena, for each other, for the solidarity that had formed in an instant. Elena stood there with tears streaming down her face, overwhelmed not by the insult, but by the response, by the realization that she wasn't alone, that every person in this room understood her exhaustion, her sacrifice, her value. Dr. Chun pulled Elena into a hug, his voice gentle now. "You never have to face that alone. Now while we're here, we're a family, and family protects each other." And suddenly a dozen other people were hugging her, telling her stories of times she'd helped them. The hospital CEO approached Elena personally, handing her a business card. "I want you to know that I've approved an immediate review of our staff protection policies. We're implementing a zero-tolerance policy for visitor and patient family abuse of staff. And personally, thank you for everything you do. I see you. I value you, and this hospital would collapse without nurses like you." A patient's family member who'd been sitting quietly in the corner approached Elena timidly. "My mother is in the ICU, and you've been taking care of her. And the way you talk to her, the way you hold her hand, even though she's not conscious, you're not just a nurse, you're an angel." Elena's 15-minute break had turned into 30, but nobody cared. And when she finally returned to the ICU, she found that other departments had sent floating nurses to cover her patients, giving her an extra hour to decompress. There was a card at the nurses' station signed by staff from every department. Simple words that meant everything. "We stand with you. We see you. You matter." The story spread through the hospital like wildfire, then to social media when someone posted the video. And suddenly Elena became a symbol of healthcare workers everywhere who face abuse, exhaustion, and disrespect while literally saving lives. The businessman who'd started it all, his company saw the viral video, saw their executive mocking healthcare workers, and he was quietly asked to resign within 48 hours, a small but satisfying consequence for cruelty casually deployed. But the real change was bigger than one. Fired executive hospitals across the city started implementing better staff protection policies, security training on handling abusive visitors, mental health resources for burned-out workers. Sometimes the worst moments become catalysts for change, not because of the cruelty, but because of the courage it takes to stand up, to speak out, and because of communities that decide enough is enough. Don't ever let anyone diminish what healthcare workers do. Don't ever think their exhaustion is weakness or their emotion is because they're holding the line between life and death every single day. Elena still works in the ICU at Metropolitan General, still does the brutal shifts that turn into 14 hours, still holds hands and saves lives. But now when she walks into that cafeteria, people smile, nod in recognition. There's an unspoken understanding that runs through every healthcare worker there. We are not alone. We are not invisible. We are a family, and we protect our own. Hit subscribe if this story reminded you that healthcare workers are heroes who deserve our respect, not just in theory, but in practice, that standing up for others is how we build better communities. And drop a comment below. Do you know a healthcare worker who has changed your life?